Hello, welcome to Pali Momi's Bariatric Nutrition Educational Session. My name is Leanne Metcalf and I am a dietitian with the program here at Pali Momi. So the purpose of this educational session is to introduce you to the nutritional guidelines after bariatric surgery. As you may have already heard, either in the informational session or with your one-on-one consultation with the surgeon, is that bariatric surgery is really a tool. It's a tool for weight loss. So we like to say that it is going to account for about 10% of your success, but the remaining is going to come from what you decide to do with the surgery and how you decide to utilize it. So bariatric surgery will assist with the weight loss, and what it can also do is it can help to improve certain medical conditions. So if you have high blood pressure, if you have type 2 diabetes or sleep apnea, bariatric surgery can help to improve these conditions. However, it cannot work alone, so it does require significant commitment from you. Okay, so what that means is you have to make sure you're maintaining healthy habits, which includes diet and exercise. So first thing we'll go over are your 6 keys to success. So your first key to success is that commitment. So like I said, bariatric surgery requires lifelong commitment to a healthy diet and exercise. You owe it to yourself, right? You're giving yourself a second shot. So make sure you do it right this time, okay? The second key to success is going to be your proteins. So protein is really going to be your most important macronutrient after surgery. We don't have you on a high protein bodybuilder diet, but what we do have you on is a protein focused diet, okay? And the main reason we have you on a protein focused diet is because protein is essential for healing after surgery, okay? It's also very important for maintenance of your muscle, your immune function, and of course for your hair, okay? So one of the main things to remember is the reason why we focus on protein first is because of the size of your stomach. You have limited capacity now. If you're having the gastric bypass, the size of your stomach is about the size of an egg, right? If you're going with the sleeve gastrectomy, your pouches may be the size of a small apple banana. So if you fill up on other things first, you simply won't have room for the protein, okay? So that's why we always say protein first. Number 3 are your fluids. So you want to make sure you're staying adequately hydrated. The recommendation is for 64 ounces or 8 cups of fluids per day. It's different from staying hydrated prior to surgery. Prior to surgery, if you feel thirsty, you can chug half a bottle of water and then you feel fine, right? After surgery, if you chug half that bottle of water, guess what's going to happen? Well, it's going to fill up your pouch. It doesn't have anywhere else to go, so it will come back out. Okay, so the idea is you want to start getting into the habit of taking sips of fluids every 10 minutes throughout the day. So from the moment you wake up until you're going to bed, you're going to be drinking constantly. Number 4 in your keys to success is to always practice your mindful eating. So this step is actually really very important. Being mindful means understanding what kind of an eater you are. Identifying what your triggers are. Are you eating because you're physically hungry, or are you eating because the food is there, or because you're at a party and it's a celebration? So you always want to be mindful of your reason for eating. One of the reasons why patients regain their weight after surgery is because they forget to be mindful. They go back to mindlessly eating, to grazing all day or to snacking, and those types of habits will eventually put the weight back on, okay? So always practicing mindful eating is very important. Number 5 are your vitamins and your minerals. So you will have to take vitamins and minerals for the rest of your life. This is very, very important. With the gastric bypass, you are going to experience malabsorption of certain vitamins and minerals. So that's why we need to make sure you're supplementing. And with the sleeve gastrectomy, because the pouch is very small, you won't be able to eat enough to support your daily needs for vitamins and minerals. So we will have you on a multivitamin mineral supplement with iron every day, as well as a calcium supplement every day. And then the last thing is going to be exercise. So you can't talk about diet without exercise, right? What we want you doing is we want you being physically active for at least 60 minutes a day. It doesn't matter what type of exercise you do as long as you're getting your heart rate up. The most important thing that I really stress to my patients about exercise is that as you're losing weight very rapidly, the body sometimes will want to eat up your muscle. And that's something that we really want to avoid as you're losing weight. So exercise will help to maintain the muscle that you do have. For women, as we age, we tend to lose bone, right? So weight-bearing exercises helps to also protect our bones. And then the last thing is in a maintenance phase, exercise is really one of the key components that helps to prevent weight from coming back on. Bariatric surgery is a tool that will help you with weight loss. But the most important thing to remember is that it requires lifestyle changes, and that includes diet and exercise. So if you have more questions or you want to learn more about our program, our contact information is located on our webpage.